There is a prescription opioid epidemic in the United States. We will be looking at a fast-paced urgent care that serves the Portland, Oregon area, both metropolitan as well as the surrounding suburban areas. The population is internationally represented with a wide variety of ethnicities, races, and cultures. This organization has a strong focus on preventive care and is a leader in the health industry. They are actively establishing guidelines to reduce the prescription opioids. The urgent care serves as both an after-hours source of care for primary care, as well as treating less emergent symptoms. The organization is a well-established, nonprofit health system that does not hold religious affiliation. Its spirit of inquiry utilizes continuous quality improvement with unit-based teams that are made up of all team members. Change is embraced and encouraged at all levels of leadership. The overprescribing of opioids can lead to health issues, dependence, and in some cases, even death. Opioid sales and opioid-related deaths have quadrupled between 1999 and 2014. It has been found that prescribing more than 1 week's worth of opioids doubles the chances of continued use after 1 year. One of the most common reasons for seeking medical attention in the United States is chronic pain. Prescription opioids are frequently prescribed to manage pain. Residents graduating from medical school have self-reported an inability to accurately diagnose and treat addiction. Questions to think about. Why are clinicians prescribing so many opioid pain relievers? Do patients understand the risks associated with opioid pain relievers? What alternatives exist in place of opioid pain relievers? Pain control is a secondary prevention. The key is to utilize alternative therapies for mild to moderate pain, reserving opioid pain control for severe and acute pain, as well as pain associated with malignancy. What are some strengths of this organization? They currently have an opioid therapy plan to help reduce opioid prescriptions. They strive to be on the cutting edge of health trends, being that opioid prescription reduction is a current hot topic item. They're working hard to reduce these. The organization uses unit-based teams for addressing challenges. This increases staff buy-in. Let's look at the weaknesses. With the opioid therapy plan, providers are currently allowed to override the plan. Because the urgent care is extremely fast-paced, there isn't a lot of face-to-face interaction between support staff and providers. This can lead to communication breakdowns. This urgent care is one of 6 within the system, so change will have to be universal and it will go at a slower pace. What is standing in the way of reducing opioid prescriptions? Reduced patient satisfaction and satisfaction scores. I know that currently this organization utilizes Press Ganey, and if patients are upset, those scores go down. Patients pressure providers for opioids. Some providers believe they lack sufficient education in addiction medicine. How do we improve? Support staff print off a pre-visit summary, and on this summary, it notes in a very obscure area that a patient would or would not be on an opioid therapy plan. It is very easily overlooked. If the support staff member highlights this area, it allows the provider to have that upfront communication. Additionally, highlighting opioid therapy reduction in the unit-based team brings attention to the issue and increases staff awareness. Providers should be educating and referring their patients for alternative therapies for pain control. Per the Centers for Disease Control, if an opioid is necessary, use the lowest effective dose.